Good morning to one and all. Welcome you all to the third AIOC midterm. I am going to present my free paper on comparison of serum and vitreous biomarkers in patients of type 1 and type 2 diabetes mellitus with diabetic retinopathy, and also their correlation with the traditional systemic blood parameters. The co-authors of my paper are Dr. Nawazish and Dr. Shauryavardhan Azad. Coming on to the introduction, the estimated prevalence of diabetes worldwide in 2019 was about 463 million, which was projected to increase to about 700 million. And also, as we all know, India is an upcoming diabetic capital. Diabetes is an amalgamation of various pathogenic pathways that interact among themselves and culminate into a numerous complications which are related to the primary disease. So there have been various landmark trials like DCCT, EDIC and UKPDS which have always emphasized on the fact of glycemic and systemic control to control the disease. However, there are certain patients with poor diabetes control who don't progress. On the other hand, we have some patients with a very good diabetes control who do progress with the disease. So are there certain local factors that are acting? So we came up with the objective to assess the levels of various biomarkers across different pathogenic pathways in diabetic retinopathy in serum and vitreous and correlate their levels with the traditional blood systemic investigations that we are routinely doing in the patients of type 1 and type 2 diabetes. And we also compared and contrasted them among the patients of type 1 and type 2 diabetes mellitus patients with PDR. It was a cross-sectional observational control study with a sample size of about 40 patients. The 10 vitreous samples were taken from patients of type 1 diabetes mellitus, that is juvenile onset diabetes. 20 samples were taken from type 2 diabetes mellitus because they were more common naturally. And 10 samples were used as a control from the patients of macular hole who did not have any systemic illness. So we screened the patients in our OPD, assessed their best corrected visual acuity, IOP, did fundus evaluation and included them into respective groups. Then we did blood sampling for those patients and evaluated hemoglobin levels, blood sugars levels, RFT, HbA1c, and also we took the plasma of the patient, centrifugated it to calculate to assess the levels of VEGF, glutamate, renin, angiotensin, TNF1 alpha. Also, these patients underwent vitrectomy and we took about 0.5 ml of undiluted vitreous sample and evaluated again it for renin, angiotensin 2, VEGF, TNF alpha and glutamate. As you can all see that we had the factors from various pathogenic pathways. So for the ease of understanding, we divided our study into 4 basic steps. First of all, we tried to establish whether these biomarkers were elevated in the plasma and the vitreous as compared to the controls in both type 1 and type 2. As you can see all the 4 top tables, we can see there is a statistically significant difference in the levels of VEGF, glutamate, angiotensin 2, renin and TNF1 alpha in both the groups as compared to the control group which were macular hole patients. On step 2, again we wanted to evaluate whether these factors were increasing in a linear pattern in both plasma and the vitreous. So we found that it was only plasma VEGF and vitreous VEGF levels that were linearly correlating. Other did not show any significant correlation, which means that when a serum levels of VEGF were going up, similarly in a similar fashion vitreous VEGF levels were going up. However, this pattern was absent in other 4 factors under evaluation. So for step 3, then we correlated these factors with the traditional blood investigations, that whether FBS, RBS, HbA1c levels were linearly correlating with the levels of vitreous and serum levels of the biomarkers under study. So in this table, as we can see, the yellow ones are the type 2 diabetic mellitus patient. We can see all the blood parameters seen on the left were correlating with the levels of renin, VEGF, angiotensin and TNF in type 2 diabetes patient. However, in case of type 1 diabetes patient, it was only VEGF levels that was linearly correlating with these blood investigation. Similar was the pattern with the vitreous levels of all the biomarkers under study. The fourth and the final step of our study was to contrast these factors among type 1 and type 2 diabetes mellitus patient. As we all know, there is a significant difference in the pathophysiology of both the types of diabetes. So what we could see was both the groups were comparable in terms of blood investigation, except the nephropathy was more common in type 1 diabetes patient, which was a statistically significant result. And on comparing plasma levels of these biomarkers in type 2 and type 1 diabetes mellitus, we found that angiotensin 2, renin and TNF alpha were markedly elevated in type 2 diabetes mellitus patients in plasma as compared to type 1 diabetes. And the vitreous levels, again we contrasted them. It was VEGF levels that was seriously very high in cases of type 1 diabetes mellitus patients in vitreous as compared to the type 2. So coming on to the discussion, there have been various pathways under evaluation. The progression of DR definitely depends upon the glycemic control of the patient. All these factors under evaluation were such chosen that they represented that they were the representative of the different pathways. So we came up with a conclusion that in type 1 diabetes mellitus, it was angiogenic pathway that was predominant. So again, anti-VEGF therapy continues to be a very strict and a very effective therapy in type 1 diabetes. However, in type 2, there were other pathways like TNF alpha, indicating inflammatory pathway, RAS pathway, renin and angiotensin that were elevated and therefore need a newer therapeutic interventions that need to be explored for treatment of type 2 diabetes mellitus with diabetic retinopathy. Thank you. Sir, what was the outcome of this study was there have been many such studies, but the thing was that in a single cohort of patients, we evaluated all the pathways, representative markers of all the pathways. So what we came up with the result was that in type 2 diabetes mellitus, even in the vitreous, there were inflammatory factors that were elevated. So it is not only the VEGF that was the causative agent for causing the proliferation of the disease, it was renin levels, angiotensin levels, as well as inflammatory pathways indicated by TNF alpha and glutamate in our study that were represented. So we need to explore certain therapies that we can limit these factors locally as well, which can decrease the progression of the disease.
It was nice presentation. Which kit was used for?
Human ELISA kits were used.
Indian based or Germany based company?
Indian based, ma'am.
Indian based. And how it will contribute according to you?
Ma'am, as I said, basically currently what we are practicing is we are only giving anti-VEGF. We have very narrow approach to restricting the pathway. Like we are only inhibiting VEGF levels in the pathway, and we have come up with faricimab, which are again more or less related to angiopoiesis only. So what we bring up with this study is there are other pathways like certain anti-inflammatory agents that can decrease or bring down the levels of TNF alpha, certain agents that can bring down the level of RAS and angiotensin. Like for hypertension, we decrease the level of RAS and angiotensin systemically to control the hypertension. Can we explore something locally to decrease these levels, which might be causative especially in type 2 diabetes mellitus patients?
So what was the inclusion criteria? They were lasered patients or unlasered patients?
They were the patients who had indications of vitrectomy. We did not strictly mark them whether they were lasered or unlasered.
Okay, that was the...
And another shortcoming that I am pointing out myself is that we also had certain hypertensive patients which were on ACE inhibitors and RAS pathway inhibitors. So that can be a shortcoming in our study that might be affecting the levels of these factors even